Memphis is a place of hope.
Memphis is grit and grind.
Memphis is a movement. Memphis is a wave. It's a story in motion.
Memphis is got this history that we always have to work on about oppression, discrimination, and issues between blacks and whites. So one of the things that you have to think about when you're working with young gay black men is they're coming with that history on their backs. And it's my job to equalize the power, not theirs.
I think every human being, but especially youth, will read on people's expressions. They can make out when someone's making a judgment.
They look for authenticity. When I first have a new patient, I share with them from the very beginning. I don't care if you slept with 7 women yesterday and 7 men the day before. I'm not here to judge you.
First of all, a person has to love what they are doing, and they have to show that they love it, and they have to truly understand and relate to the customers they are serving. They embody joy in their work. They embody a liking for working with youth.
Whenever I tell my patients I'm going to do something or that I'm going to be there for them, I make sure that I'm there, because trust can be a deal maker or a deal breaker when it comes to this industry. You want that person to feel comfortable enough to open up and tell you what they need so that you can provide that, so that it will benefit them for linkage to care. I hold them accountable and they hold me accountable as well.
The sole purpose for Connect to Protect is to mobilize community stakeholders in order to develop a solid prevention plan for HIV acquisition and transmission for our youth and young adults. Many of the community partners that were at the table, so we had the school systems, we had just grassroots organizations, we had the faith-based community, we had the local health departments and some of the other community-based groups that are funded to do testing, to come together and talk about these solid strategies that we could do to combat the high numbers of HIV and AIDS. We wanted to do a holistic approach. So we didn't just have the testing agencies at the table or the AIDS service organizations at the table. We wanted to talk to them in their schools. We wanted to talk to them in their communities of faith. We also wanted to court groups that would provide job opportunities. There was sex for service going on. There was not prostitution, but it was survival sex. It's the way we categorized it. And so how could we set them up so that they could become self-sufficient, so that they wouldn't fall back into the same patterns and behaviors? So it went beyond just individual level prevention, but we were looking at more structural level changes that could happen per environment and then have a greater impact on those individuals within that community.
A large number, probably the majority of our patients are young gay black men. HIV is one more thing on a whole bucket of issues that they've had to survive and deal with. So it's really important to look at their mental health, their emotional health especially, and the other factors that have occurred in their life. Understanding how they survive some of those other issues helps us guide them in surviving HIV.
We have a boots on the ground approach. We meet all of our clients where they are. If they don't feel comfortable with meeting us at their homes, we will go out to restaurants, just wherever the client feels comfortable.
I found out that I was positive in 2010. At that time, I didn't know anybody who was positive. That helped me, of course, with my HIV care, but also they helped me graduate from school, they helped me with jobs, they helped me just with personal life. It just became such a safety net of individuals who care about you from the top to bottom, and I feel like that it helped me in so many ways, just being able to do the same work now that I'm a graduate of this program. The SMILE program addresses barriers to care by putting individuals who make it okay and comfortable to accept what it is that's going on with you. They have very relatable individuals. They're not only there to help you with your HIV care, but they help you to just maintain.
Here at Smile, we address barriers to care. We do case management. We create different programs to help with transportation. We address housing issues. We even go with clients as a support system to their medical appointments. We've cultivated our program to address issues that we've seen in the community.
Sometimes it's just the fact that they are in denial, or they may just not want to think about HIV, and picking up that phone or making that appointment or coming to that appointment is the reminder about the disease. So in summary, what happens is we can continue working on these silos of healthcare systems, but what really works is when you have that one individual called the linkage to care worker who links up with the patient from the time the diagnosis is made and is constantly there until the appointment is made.
When it comes to trying to link clients to care or even get them to open up about the barriers to care, even testing can be a bit of a challenge.
Oftentimes you will find that people are hesitant to go to a government agency because they don't have that trust factor. But once you build a coalition with an agency that serves black gay men and they can vouch for you and you can vouch for them, it kind of helps with the epidemic, helps make things better.
I believe that the health department's role in the Linkage to Care and SMILE program has been an integral part of the development, growth, and then the productivity of the program. And part of that has been, we basically allowed that person to sort of be a part of the health department.
The biggest benefits of the Connect to Protect SMILE partnership is that the Connect to Protect is a sounding board for the community. And by partnering with SMILE, we're able to take those barriers that are identified by the young Black MSM community to those stakeholders so that we can create policy change and practices.